Hi everyone. I want us to talk about a very sensitive topic which affects our men and which is called erectile dysfunction. It is very sensitive, it has affected many homes. Um, Most marriages are not working because of this issue, and at times it can be due to medical conditions, not that the person was born that way. So I want us to learn the basics, just know a little about erectile dysfunction before we judge anyone that has this problem. So what is it? Erectile dysfunction is the persistent inability to achieve or maintain an erection firm enough for satisfactory sexual activity. Okay. So it is also at times referred to as impotence in medical terms, although this term is now less commonly used in medical practice. So, erectile dysfunction is distinct from other sexual problems such as premature ejaculation. This is totally different, or lack of libido. Okay, so lack of libido and premature ejaculation is different from erectile dysfunction. So, how does an erection occur? Do we know? Well, an erection results from increased blood flow into the penis or the penile shaft, triggered by nerve signals from the brain and spinal cord in response to sexual arousal. So sex starts from here, not anywhere else. Learn that today. Okay? This process involves hormones, blood vessels, nerves, and muscle working together. So you see how sex involves a lot of things. For your body to be sexually active, there are a lot of things that are involved: hormones, blood vessels, nerves, and muscles. So what are the symptoms of erectile dysfunction? Difficulty getting an erection. Okay? Difficulty maintaining an erection during sexual activities. Reduced rigidity of erections. Inability to get an erection at any time. You heard that. So what are the causes? We have physical causes, psychological causes, and lifestyle factors. So under physical causes, we have vascular diseases like high blood pressure, okay, and heart diseases. I'm just going to mention the common things that people know. I don't want to go into medical terms. Those high blood pressure, heart disease can lead to this. Diabetes, high blood sugar, that is, can damage blood vessels and nerves, hence erectile dysfunction. Hormonal imbalance, low testosterone or thyroid disorders can lead to this. Okay? Neurological conditions such as multiple sclerosis, spinal cord injuries, those people who are involved in RTS, some of them end up with this. Or even nerve damage from surgery. There are people who undergo surgery and end up having their nerves damaged. Hence, they can't have a good erection. Okay? Chronic illnesses, for example, kidney disease, obesity. Those people who are obese, most of them have this problem. Chronic obstructive pulmonary disease can also lead to this problem. Now, penile conditions also, like enlarged prostates, can also lead to this. So you're at 70, 80 years and you see yourself, you marry a young lady, you can't rise to the occasion. BPH, enlarged prostates. These are the things that cause the physical causes. Medications. Those who are are taking antidepressants, antihypertensives, pain relievers, and some chemotherapy drugs, they cause this. So take care of yourself. Don't get hypertension. Don't get into depression that you start taking antidepressants. My brother, you will not. You will not perform. And then you start saying that somebody has bewitched you. There's no bewitching. Okay? Psychological causes. Hey, stress, anxiety, or even depression. Performance anxiety. You're worried that, oh, I won't perform well. Do it. Let the recipient complain, not you. Okay? Relationship problems. Those who are being left. Those who have no one. A man is just alone. In fact, if they spend most of the time alone, they end up having this because they're going to anxiety next, is depression next. Low self-esteem. Appreciate yourself as a man the way as you are. God created you that way. Whether you have a big penis or a small one, accept who you are and learn how to work with what you have. Simple. Lifestyle causes. Smoking, excessive alcohol consumption, illicit drug use, lack of physical activity. Excessive alcohol. You get drunk, you sleep. There's nothing else you do. That is why there are some parts in our country, some regions in our country where there are no children. The nursery schools are empty because men are always drunk. How will you perform when you're always drunk? Their women are suffering. They want kids, but men are not there. They are always drunk, sleeping, drunk. Mogoka. Mogoka is making our men not perform. I'm sorry to say. Diagnosis. So how do we diagnose? Medical and sexual history. We can get it from history. When someone realizes it and comes to the outpatient, tells me, oh, I have this, I'm not rising to the occasion, blah blah. Physical examination. Focus on the genitourinary, vascular, endocrine, and neurological systems. We can check on you to see whether yes. Lab test to check for diabetes, hormone levels. When you have sugars and you have hormone issues, those are underlying conditions that can give you that. Okay. Doppler ultrasound can also be done to assess blood flow to the penis. Okay. So what are the complications? Erectile dysfunction can lead to several psychosocial and physical health complications. Now these include anxiety, depression, and low self-esteem. Relationship and intimacy problems. Performance anxiety, fertility issues, increased risk of cardiovascular disease, stroke, and overall mortality. You get what I'm saying? Complications, increased risk of cardiovascular disease, stroke, and overall mortality. Erectile dysfunction may be an early marker for heart disease. I hope you're getting me there. Now, treatment options. Treatment options. Whatever disease we have, we try to manage it the way God guides us. So lifestyle modifications. Quit smoking, reduce alcohol, do exercise, healthy diet and weight management. Very important. Medications. Medications, there are people who are prescribed for the blue pill. Unfortunately, most of our men are abusing that drug. And you'll find very young men at the age of 20s taking that drug for what? You're destroying yourself. By the time you reach my age, you're done. There's nothing you can do. Kindly, if it's not prescribed by a doctor, don't use sildenafil or the blue pill. Devices. We have vacuum erection devices that can assist you surgery. Penile implants for refractory cases can be done. Psychological counseling, those who are having problems psychologically, they can go for counseling for stress, anxiety, and relationship issues. Talk about it. Go talk about it. Talk about it. Come to my inbox. Let's talk. I won't judge you. I will try and listen to you and know where the problem is. Emerging therapies, low intensity shockwave therapy. This is more complicated. It's done in high advanced hospitals. Okay? So prevention. How do you prevent? Maintain a healthy diet, exercise regularly, avoid smoking and excessive drinking, manage chronic conditions like diabetes, hypertension, and high cholesterol. Address mental health and manage stress. Manage stress. Know how to manage your stress. So, erectile dysfunction is common and increases with age. As you reach 40 years, you start going slow. Know that. But it is not an inevitable part of aging. There are those who maintain till, depends with how you manage yourself. Often treatable and seeking medical advice is important, as erectile dysfunction can be a sign of other health issues, especially cardiovascular disease. So as I mentioned earlier, it is a marker of other issues like cardiovascular disease. Early intervention and healthy lifestyle choices can prevent or improve ED in many cases. So I believe you've learned something today about erectile dysfunction. You have an idea of what it is, and you can confidently distinct it from